All right, we are going to show you how to instill TPA into a chest tube. So there's two varieties of chest tubes you'll encounter in the PICU or on peds. The first variety is for our smaller patients. It's the pigtail. It has a 3-way stopcock on it. The second variety is the self-sealing chest tube, which is for our larger patients. The supplies that you will need are a syringe, your TPA, a needle if you're using the self-sealing, which is 19 gauges or less, some alcohol swabs, and potentially a hemostat. We're going to start with the pigtail, just because it's a little simpler. So what you will do is you'll wash your hands, you'll put some gloves on, you will draw up your prescribed TPA amount for your patient. You will scrub the hub with an alcohol swab. Scrub, 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 scrub. And you'll turn your stopcock off to the drainage chamber open to the patient. At this point, you'll have your syringe full of TPA. You'll attach it to the clave. And instill your TPA slowly over a minimum of 20 to 45 seconds. You will expect your patient to cough, and then you will keep your chest tube clamped. So turning the stopcock clamped for the prescribed amount of time, and then there will be a prescription for turning the patient as necessary. So for the self-sealing variety, you will need, again, a needle that is 19 gauges or less, your hemostat, your TPA, and your alcohol swab. The only different principle is that this is a self-sealing tube, so you don't have a clave that you're going to be working with. You'll wash your hands, you'll put gloves on. You will take your needle out of the package. You've got your syringe full of the prescribed amount of TPA, it may be larger than this syringe. Attach your needle. You're going to clamp your chest tube, whatever you prefer. I prefer to use the hemostat, clamping the chest tube like so. You're going to instill your TPA as close to the patient as possible. So you'll clean off the area that you're going to instill your TPA. And then you'll remove the cap from the needle. Again, moving slowly, you'll insert the needle into the tube, slowly instilling the TPA, minimum of 20 to 45 seconds. You'll keep the chest tube clamped. Remove the syringe, cap the needle. You'll keep your chest tube clamped for the prescribed amount of time. You'll rotate your patient in the prescribed manner. And then in both instances, make sure that you unclamp your chest tube at the end, like so.